Hi, I'm Kelsey. I'm one of the VAD coordinators here at Lehigh Valley Hospital. Next, we are going to go over how to do a daily dressing change. First, you want to make sure that you're opening up your daily driveline management kit. You want to open up the kit away from you first. Make sure you're only touching the corners. Do not touch anything in the center. Inside, you're going to find gloves and masks. The person changing the dressing should have a mask on, as well as the patient. And each person should also have a hat on. Next, you have a pair of gloves at the top. These are your clean gloves to take off the dressing. At the bottom of the dressing, there's a perforation. If you tear at the perforation, it'll rip the dressing and then you can pull it straight up. You want to make sure that you remove the Silverlawn. Silverlawn should be changed with every dressing change. The Foley anchor can stay in place because we are doing daily dressing changes. However, if it needs to be replaced, you will be provided with separate anchors from your DME, and you can use one of those if it's needed. Next, we're ready to start the sterile part of the change. So you want to take your sterile gloves out. You want to make sure you're not touching the inside. Start with your dominant hand first. And grab the inside of the glove. Take your 4 fingers underneath the cuff. Get that thumb out of the way. Praying hands and go back to your kit. Next, you want to clean the site with your ChloraPrep. Again, to activate the ChloraPrep, you want to pinch till it gets wet. You want to start in the center of the driveline, starting centrally and working your way out. Remember to scrub vigorously to get that site nice and clean. Once you move away from the center, you should not go back. Your second ChloraPrep, pinch till it gets wet. Again, start in the center, scrubbing vigorously, and work your way out, not going back to the center. Now that the site is clean, we can place the Silverlawn around the driveline site. So you want to open up your packet of Silverlawn. Along with your sterile saline wipe. You want to press your saline wipe against the Silverlawn. The water is what activates the silver inside the patch. You want to place your Silverlawn around the driveline, making sure that the silver is touching the skin. You should be seeing white when you're looking at it. You should not see the silver. Next, we are going to use our skin prep for around the area where the dressing will be placed. There are 2 of them. You can use one or both. Just around where the dressing is going to be. I'm going to use both for demonstration. The next step is the gauze. You will notice that there are sponges that have a slit in them and sponges that don't. There are small sponges and there are large sponges. You do not have to use all the sponges. It's all going to depend on how much drainage you have coming out of the driveline site. I always recommend starting with your perforated sponge and then adding more sponges as you need them. Whatever sponges you don't use, you can place to the side. Next, we are going to place the dressing. First part is to place the big dressing. Notice this dressing does not have a window in it. It's because it absorbs better. We're going to put this over the driveline site, making sure we're doing our best to cover all the sponges we've placed. Next, we're going to pull the bottom out. And just like with this weekly, you want to make sure that your drive line is coming out of that center piece. The last part is the interlocking piece of the dressing. You want to make sure you're going underneath the drive line. Snug it up real tight. And then pull it apart to interlock that dressing. And that's how you do a daily dressing.